Hi, I'm Tim with Post-Acute Elder Care Platform. I'm introducing you to Addie. Addie is our care management coordination assistant. So what Addie does here is Addie is a AI platform that resides in your EHR, and upon or near the time of admission, she identifies patients that are going to require post-acute care. She doesn't sit there and say what level of post-acute care they're going to require at that point, but she does identify those who will need some sort of assistance after their hospital stay. But then she uses several other AI engines to mitigate and identify and bring to light issues as well as selection of the appropriate care settings. Additionally, she will also um, submit for prior authorizations, help with the booking of transportation, and the actual transitioning of that patient. There is another section for this video that's on the post-acute care side, where Addie is much more of a command center type functionality on that post-acute care organization's recovery for that patient. So with that sort of like introduction, kind of like to go over the user interface here. So when you sign into Epic or Meditech or Cerner, whichever EHR that you are using, our system has been developed in partnership with the Mayo Clinic. Mayo is also working with us to provide our services directly into the data centers for those EHRs. So the first one will be operational on will be Epic, and then Meditech, and then Cerner a little bit later in 2025. So we have our toggle menu here on the side. We go through a dashboard, conversations, our PAC scorecard, settings, and so forth, sign out. And this down here is actually the Addie interface herself, where you can ask Addie questions regarding your patient, and also eventually you'll also be able to do, Addie will be able to do tasks as well. We can get more to that in person later on. Now, going on to our page here, we see status, patient name, PAC prediction, care team, and so forth. The first one over here, status, indicates whether or not the patient's new, if there's any sort of status changes in that patient, if there's something going on with that patient where the transition process is requiring additional resources or help. This is where that notification would take place. I use this a lot. I give a lot of demos. So the only one that we have here that's available to be seen is actually Mr. James Brown, which indicates this patient is new, and we can kind of go through him a little bit more. The next section is going to be our patient demo, where we have name, we have their age, the sex, the patient number, as well as their insurance. Then our next row is our PAC prediction. So upon admission, information is entered into the EHR. This is usually some sort of structured information. It's going to have like your name, what the patient was admitted for. It's going to be some codes that are going to be associated with that. From that information, Addie is able to make a pretty good prediction on whether or not this patient is going to require post-acute care or not. But what we don't want to do is we don't want to sit there and say at this point, this patient is going to require skilled nursing care, when the variation, the patient could be can improve or very rapidly, or may not, and that may adjust the care team's sort of like drive for that patient. So if we identify this patient is going to need skill right away, everybody on the team is working towards skill, as opposed to saying, hey, this patient's actually done pretty well, maybe home health is a better option. So this is actually left open, and we can go through and we can override this if we don't like the recommendation by the algorithm. And in this situation for Mr. James Brown, that's was the case. So James Brown was actually a palliative care patient, and it sounds like he's revoking services. So this was no, and it was manual. Now the next one is going to be our care team, and you may be able to look up on EHR and find your care teams for your patients very easily. What this is doing is this is actually tracking those individuals on the care teams. We're collecting metrics on them, but also your post-acute care providers, if they're working on a patient, pulling through that patient for you, whatever it may be, they're able to communicate or connect with that care team individual in order to get like the orders or whatever it is that they need to get that patient to their building faster and more appropriately. The next one we have is going to be our length of stay. That's pretty straightforward, I think. However, there are a few alarms and whistles that are associated with that when this patient starts to be here for a little bit longer. And additionally, it also gets escalated on our end too. Now here we have care plan, and care plan is really, it's the discharge plan. Okay, so we're looking, is there a discharge plan in place for this patient? Now, mostly we're going to see yes, 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 and then we're going to see no on this patient here, Maria. We look like she's going home, but there might be some sort of post-acute care involved here. So we have pending on this one, but we have a no here. Now, then our second PAC prediction, or a second prediction comes in place. And here we are actually looking at unstructured data. We are looking at the nursing notes, and we're also using our expert intelligence on this to say, hey, this patient is going to require skilled nursing, or this physical therapist is saying this patient requires skilled nursing care. Additionally, though, we also want to make sure that that recommendation is an accurate recommendation on here, so that can be tagged as well. We're saying this is the skilled nursing. The PT, the therapist is saying that this patient is going to be skilled, but this patient could transfer. This patient can walk 50 feet. This is not going to get authorized. So it's like warning flag central here, right? So that sort of can be mitigated or addressed in an appropriate manner. And then here we have our barriers. These are what are preventing the discharge, or what are the next steps for discharge. And many times when we were working with case management departments, or even like our experience when we work with case management departments, by the way, for the past decade, I've been working with hospitals on transitioning complex patients, right? So from patients that are kind of like stuck in the hospital. And this is what really brought out the idea. And that's why we started working with Potentia, our partners on this. So this allows case managers to see patients that, that's not just their patients, but also like the patients of their neighbor. And because everything happens as soon as that other case manager sits up to go do something, whether it is to go down the hall or go get something signed, there's gonna be 5 phone calls, 3 accepting facilities, 2 more are going to need orders. All that happens like right then. So that this allows for those case managers to be able to kind of keep track of that, work as a team. Now, let's go take a look at Alice here. When we click on Alice, we get much more of a command center type functionality, or command center type view. We're going to have a menu options up here on the top: care summaries, documents, facilities, itinerary. This is the overview. This is what's going on with the patient. We have a care plan that's in place with this patient. We have a facility match. So Addie has gone through and matched facilities that are going to meet the care needs for our patient. The patient has gone through and ranked in order which facilities that they are interested in and which ones they're not interested in. So in this situation, we have a match. So we have one where the patient is agreeable and the facility is a match. We have 2 that we're reviewing, and then we have 1 that's not happening. The prior authorization here is highlighted in red because we're running over time. Okay, so Addie's going to go in and going to tag that insurance company saying, hey, we are getting close to discharge. We're keeping metrics on that, right? We're identifying, we're saying, hey, insurance company, you got all the information you need. This is matching your business rules. Okay, so the next time you're having that meeting, that length of stay meeting, or whatever it may be with the insurance company, you have data on your side that says, this is what's holding this up. Okay, let's get this together. Discharge order, obviously it's pending right now. This prior authorization, this is a pre-certification for authorization, right? This is the placeholder, right? That doesn't go into effect, and we know that until that discharge order is taking place. That's the business rules for most of them, if not all. Now, our transfer, of course, is pending too. Care summaries. So we have multiple care summaries that we're looking at for our patients. We have a hospital view. Case manager is going to see this. This tells us everything that's going on with the patient on the acute care and the post-acute care setting, right? The case manager in our model is a Hollywood executive producer, and they're trying to make a blockbuster film out of this patient's recovery, right? Patients is the star. The care team, like your nurses, your physicians, your therapists, that's your writers and directors. Post-acute care, that's Hulu, Netflix, all that sort of stuff. So we want to make this is going to be a blockbuster film. It's not going to be straight to DVD. We're going to do the best we can with what we got. So this is the production summary right here, right? We have our age, gender, mission status. It tells us what the mission details, medical history, and this is an evolving document, right? Our LLMs are constantly going through the documentation, the unstructured data, and pulling out the relevant information for the case manager so they can understand what's going on with their patient quickly. Now we have PAC. So this is the care summary for post-acute. So this is centered upon what is of interest to post-acute care organizations, right? Admission details, medical history, progress therapy recommendations, discharge disposition. So this is discharge from post-acute care. What are we looking at here, right? We also have prior authorization status and barriers to discharge. And then the insurance companies, right? What does the insurance companies need? This is essentially as a cover sheet. If you're familiar with how typically a post-acute care organization will get a referral or something like that, in the past, because there's such a large number of referrals that are received daily, it's anywhere from 50 to 100. You only have a couple minutes on each one. There's no way that you are reading a 200-page document and you're not leaving stuff on the table, right? So what our system is doing is pulling out the relevant information for them. But even on the post-acute care side, and they're using Addie, is populating that information into their EHR, right? It's their PCC system, so they're not leaving anything for that patient's care. But so that's really kind of like how we're doing this here. So there's a large amount of gain for both the post-acute care and the acute care sides, and at the end of the day, it's the patient who benefits for this. The skilled nursing facilities. I mean, I tried to be really good when I was admitting patients and stuff like that, but I calculated one time I was leaving like about $40 on the table for every patient. That's a lot of money. Right, that's a lot of money. So when we are in this situation, we have an accepting facility for his patient, and the patient has been agreeable. So what we're doing here, we're looking at patient constraints. We're making sure that everything's matching here, okay, that they are meeting all the needs that our patient has. Additionally, our case managers can send and receive documentation. We want a human in the loop. We don't want to rely entirely on AI. It's very valuable, but we also need to be able to make sure that we have somebody that is, guiding through and that has their hand on the wheel here. Now we're looking at our facilities. We have timelines in our facilities. In Benedictine, they accepted this patient. They did it in 38 minutes. Edinburgh, Rochester, and Samaritan Bethany, they're going to get a ping saying, "Hey, it's been 24 hours. You haven't made a response yet. Made a decision." Now, what gives, because this patient is approaching discharge time. Additionally, the skilled nursing providers or the post-acute care providers, I keep going back to the post-acute care providers, they can accept, and they can accept with conditions, right? So they can say, we can accept, but we may need a medication. We can accept, but we're just waiting on this, right? So you may not have any accepting facilities, and we don't want them to decline like right away. But if they say we're just waiting on this, we just need this resolved, that gives us a plan, right? But then we also have other facilities that outright reject it. Now, here is the handoff, right? The itinerary. This tells us Med1 is a transportation company that gives us our driver, our contact information, because we're connected to the transport companies for that post-acute care provider. We're getting a stretcher, O2. There's, let's see, meropenem is going with the patient. Must be an infection there somewhere. It's probably just a couple days on that one. So we have PAC DME. So this is a DME that they're responsible for. They have a dolphin, a CPAP, bedside commode, and then we have medications, and then the services that'll be included in those start dates for those patients. So we all have a really good idea of what's going on with our patient. All right. And again, if we need a brief summary or something like that, or I have to ask a question, we have Addie down here on our lower corner. Now, if you have any questions or would like to learn more about Addie, there's a couple more videos onto this that we're going to be posting in the next few weeks or so. Please feel free to reach out. You're most likely getting this via a LinkedIn message, because this is going to be on a private video for YouTube. But go ahead and just connect with me on LinkedIn regarding this video. Look forward to speaking with you, and have a wonderful day.